Good day, ma'am. Today we're going to discuss to you our chosen DOH program. And to start with, I am Danica Sarito.
And my name is Jovan Madarcos.
And together, we're going to discuss the Integrated Helminth Control Program. So let us first know the definition of helminth. Helminth is a general term meaning worm. The helminths are invertebrates characterized by elongated, flat, or round bodies. So, soil-transmitted helminthiasis or STH are caused by common roundworms, whipworms, and hookworms, which remains a public health concern in the Philippines. Considered among the neglected tropical diseases or the NTDs or infectious diseases of poverty, STH are related to poor physical health, nutritional status, and school performance in children. Disease burden of STH in the country among vulnerable and high-risk groups is quite and high and way above the global standard of less than 20% cumulative prevalence. As such, this program aims to reduce the cumulative prevalence of STH to less than 20% and prevalence of moderate to heavy intensity infection to less than 2%. So, ngayon, alamin muna natin kung ano nga ba ang sanhi at kung paano natin nakukuha ang STH or soil-transmitted infections. So, answering that question, ang STH infections ay sanhi ng iba't ibang uri ng parasitic worms na nakatira sa lupa sa ating paligid. Ito ay naipapasa sa pamamagitan ng paglunok o aksidenteng pagkonsumo ng itlog ng bulate mula sa maduming pagkain o kamay, paglalakad ng walang tsinela sa lugar na may itlog ng bulate, at pag-inhale ng itlog ng bulate. Ang hindi pagiging malinis sa katawan at paligid ay maaari ring maging sanhi ng pagpapasa ng bulate.
Ngayon, alamin naman natin kung ano-ano ang mga sintomas ng mga parasitic worm infection. Kasama dito ay ang sakit ng tiyan at paglaki ng tiyan lalo na pag malala na. Pumupula ng puwitan, pagsusuka, pagtatae o constipation, kawalan ng ganang kumain at pagbaba ng timbang, panghihina ng katawan, at tugo sa dumi.
So, ano-ano ang mga epekto ng parasitic worm infections? Ang bulate o parasitic worm infections ay masasamang epekto sa mga bata, adolescents at mga buntis. Sila ay humahadlang sa maayos na kalusugan at edukasyon ng mga kabataan na maaring magdulot ng mga sumusunod. Una, pagbagal ng pisikal o mental na pag-unlad. Pangalawa, pagbaba ng physical na aktibidad o physical activity. Pangatlo, pagbaba ng grado at performance sa paaralan. At panghuli, sa mga mas malalang kaso, maaari itong magresulta sa kamatayan. Sa mga adolescents, ang parasitic worm infection ay maaaring magdulot ng paglala ng anemia, lalo na sa pagdating ng buwan ng regla sa kababaihan. Sa mga buntis naman, ito ay maaaring magdulot ng iron deficiency, anemia at malnutrition sa mga ina at sanggol. Ang mga batang may malalang impeksyon ay madalas ding masyadong pagod o masama ang pakiramdam upang pumasok sa eskwelahan o mag-focus sa pag-aaral.
Ano-ano naman ang mga gamot o treatments ang maaaring gamitin upang gamutin ang mga parasitic worm infections? Ang parasitic worm infection ay maaaring magamot sa pamamagitan ng mga deworming drug katulad ng albendazole or menbendazole.
So, paano natin maiiwasan ang parasitic worm infections? So, maaring iwasan ang parasitic worm infection gamit ang water, sanitation, and hygiene, or mas in short term, wash, na estratehiya kasama na ang mga sumusunod na aktibidad. Una, yung paggamit ng malinis na kubeta. Pangalawa, pagsali sa mga deworming activities gaya ng Offline Goodbye Bulate ng DOH. Pangatlo, pananatili ng maayos na hygiene sa pamamagitan ng paghuhugas ng kamay, lalo na bago at matapos gumamit ng kubeta. Pang-apat, pagsuot ng tsinelas sa sapatos. Panglima, pag-inom ng ligtas at malinis na tubig. Susunod, pagkain na luto ng maayos. at paghuhugas ng gulay, prutas at salad gamit ang ligtas at malinis na tubig, at paggupit at paglilinis ng kuko, at panghuli, paglilinis ng kapaligiran.
So the mission of this program is to have an STH-free Philippines. Their vision is to have a synchronized and harmonized public-private stakeholders effort in the control of soil-transmitted helminthiasis in the Philippines. The partner organizations of this program, we have the Department of Education, Department of Interior and Local Government or DILG, Public Information Agency, kasipanan ng mga broadcaster ng Pilipinas. And for the local and NGOs, you have the local government units and Vitamin Angels. Our international partners would be the Research Triangle Institute International, World Health Organization, Save the Children, and Plan International.
So, Harmonized Schedule and Combined Mass Administration, or the HSCMDA, for the month of January and July in health centers, stations, and schools. So we have here the slogan of the program: makilahok sa Uplan Goodbye Bulate para maging malusog, masikla at matalino ang inyong mga anak. So ang slogan nito ay para sa mga magulang. And as you all know, ito ay isineselebrate sa buwan ng Enero hanggang Hulyo. So now, some people may believe that having worms is good and beneficial, but it is the complete opposite. Worms survive by stealing the nutrients um, from the infected person. Infected people may suffer from lack of nutrients, poor performance in school, weakness and feeling tired, and impaired mental and physical development in growing children. Also, parasitic worm infection may cause iron deficiency, anemia in female adolescents and pregnant women, and both mother and child may suffer from malnutrition. So, people with worms may suffer abdominal pain and enlargement of abdomen for severe cases, redness or rash in the buttocks, vomiting, diarrhea, and constipation, appetite and weight loss, body weakness, and fatigue and blood in the stool. So, as part of its integrated helmet control program, the Department of Health, or the DOH, conducts harmonized schedule and combined mass drug administration every January and July in health centers, stations, and schools, declaring these months as National Deworming Months. Deworming tables such as albendazole or mebendazole can help get rid of parasitic worms. Other services include diagnosis and selective treatment in health centers, provision of safe drinking water, basic sanitation and hygiene in schools and community, and health promotion and hygiene education.
So along with deworming, the Department of Health partnered with the Department of Education to implement the provision of safe drinking water, basic sanitation and hygiene or WASH in schools and community. So why do we do WASH in schools? We do WASH in schools because of the lack of access to adequate water supply, insufficient toilet and proper hand washing facilities, and non-practice of hygiene behavior remain as the key contributors to hygiene and sanitation challenges. This sanitation also leads to anemia, stunted growth, and higher incidence of absenteeism, which consequently impede a child's learning ability to stay in school. UNICEF correctly notes that poverty is linked directly to poor sanitation and hygiene and has emphasized the vital role of government in breaking the cycle of poverty and ensuring access to improved drinking water and sanitation. On the other hand, it has been estimated that about 43.7% and 44.7% of preschool age and school age children, respectively, in the country have soil transmitted helminth infections, which are also associated with poverty, lack of access to safe and clean water, and poor sanitation and hygiene. The situation is compounded by other factors, including shortage of funds for the installation of toilet and hand washing facilities, the provision of adequate water supply and hygiene items for schools, and the implementation of school-based solid waste management. So other compounding factors include the lack of mechanisms for operation and maintenance to ensure facilities cleanliness and sustainability for continued use, and the scarce funding for the security and safekeeping of school property, which is especially urgent in the most highly congested schools in the country. So, what are the best practices to do wash in schools? The best practices around the school show that improving access to and use of water and sanitation facilities within schools and enhancing hygiene and sanitation practices can effectively halt water and sanitation related diseases. To address this challenge, the Department of Education had been conducting semi-annual deworming of kindergarten and elementary school children in all public schools nationwide under its integrated Helminth Control Program. In the last 6 years, it had combined deworming with daily toothbrushing and proper hand washing under one program. The Department Order Number 56 on 2009 titled The Immediate Construction of Water and Hand Washing Facilities in All Schools for the Prevention of Influenza A, and Department Order Number 65 titled Implementation of the Essential Healthcare Program EHCP for the School Children were issued in an effort to institutionalize good health and hygiene practices among students. So these programs propelled the effort of the country closer achieving the 2015 MDG goal of the reduction of infectious diseases and improving sanitation coverage. Even with significant gains of DepEd's deworming program, the department recognized the merit of having comprehensive approach to the promotion of hygiene and sanitation practices among school children and a clean environment in and around school to keep learners safe and healthy. Hence, the Department of Education crafted the Wash in School policy under the DepEd Order Number 10 of 2016 as a holistic program for personal health care and environmental sanitation through a set of standards for proper and correct health practices in schools.
So we have here the key components of WASH in schools. So we have eight, namely the first one, oral hygiene and proper hand washing, provision of safe and adequate water supply, provision of toilet, hand washing and drainage facilities, environmental sanitation, including the elimination of breeding grounds for mosquitoes that carry the dengue virus, and solid waste management, food sanitation, menstrual hygiene management, deworming, and hygiene and sanitation education.
So, along with the WASH, we have the implementation scheme, the three-star approach. The components of the DepEd three-star approach are the operational standards. The cornerstone of the three-star approach is a set of rubrics that articulates the incremental steps towards national standards and achieving the objective of WINS. Monitoring and evaluation system. This describes the processes involved in school self-analysis as basis for planning to address gaps and or continuous improvement. The data being collected in the WINS three-star approach, the monitoring complements the department's basic education information system. Uh, Last but not the least is the recognition mechanism. This aspect of the three-star approach ensures that schools are motivated to move towards national standards. The TSA gives premium to the effort of the school community to improve and the results of these efforts. So as you can see here, these are the rubrics for the three-star approach. For the hygiene and hand washing, we will give a 1 star if the teachers are involved. We will give 2 stars if the students and the teachers are coexisting in the implementation of the program. We will give 3 stars if student leaders participated. Along with the hygiene, we have toothbrushing and menstrual sanitation hygiene. For the sanitation and the toilets, we will give 1 stars if the overall pupil to toilet seat ratio is 101 students or higher, and there are at least 2 functional and clean toilets that are gendered segregated. We will give 2 stars if the overall pupil to toilet seat ratio is 51 to 100 students and there are more than 2 functional and clean toilets that are gendered segregated as needed and based on enrollment. And we will give 3 stars if the functional pupil to toilet ratio by gender is 50 students or less. So these rubrics, you can just read it for better understanding. We will just keep it the link down below. So that's it for our DOH program. I hope you enjoyed.
And we hope that you've learned something from our short discussion. So that is all for today. Thank you again for
For
listening.
your
Okay.